PRP treatment for hair loss. Is there any difference between the cheap and the expensive PRP treatments? The clinic I've chosen for PRP treatment for my thin hair is less expensive than the others. Now, after having my first treatment, I started to realize, is there any difference between the cheap and the expensive PRP treatments? I mean, before the treatment, I called one clinic, which is a bit expensive, and they told me that they have some expensive machines, so the cost is higher. Do the machines really matter and have an effect over the quality of plasma taken from the blood?
Thank you for your question. You submitted your question without a photo. You describe in the substance of your question that you went for a PRP treatment that was less expensive, followed by your questioning whether or not you should have gone for a PRP treatment which was more expensive. And the clinic offering the more expensive treatment states that they have better machinery. And so you want to figure out, is there an actual value in having more expensive PRP treatment? Well, this question is coming up a lot lately, and I can certainly help you get some perspective as someone who has a lot of experience with PRP. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed using PRP and a material called extracellular matrix, which we started over 7 to 8 years ago and has ultimately become a significant treatment for male and female pattern hair loss. So I think that it is very important for you to really question things in a different way. I think that one of the things that I have observed, and just to go back to some more of the origin of our treatment system, we were using PRP and this material called extracellular matrix, which is a wound healing material that literally amplifies the wound healing response so that we can get a better healing process for the donor area of a hair transplant patient, as well as get better yield in the grafts of the transplant patient. And we wanted to see if this would help. Well, not only did it help and make a big impact, but it also resulted in a lot of our patients whose thinning hair actually became thicker. These are areas that were not transplanted. Well, over the course of time, I decided to try to see, can I get long-term sustainable benefit to patients non-surgically using PRP and extracellular matrix? Well, to make a long story short, we figured out a system, an algorithm that essentially is able to non-surgically help our patients, male and female pattern hair loss, with long-term growth and improvement. And basically, our treatment is able to reactivate hair that isn't growing. Usually that means that hair in a resting stage, which by definition is proportionally greater when there's thinning, thickening of thinning hair, as well as prolonging the growth cycle. Now further, after approximately 7 to 8 years of doing these treatments, I developed a lot of experience with a wide range of patients, everything from a young 16-year-old woman to men in their 70s and women in their 70s. And we've also developed a classification system, and that classification system factors in gender, age of onset of hair loss, rate of progression, degree of progression of hair loss, as well as other medical treatments for hair loss and other medical factors, including hormonal levels as well as previous surgeries. Essentially, what we have been able to establish is a system such that we have patients who we've done one injection treatment for, who had sustainable growth for exceeding 5 years. Now that of course does not apply to everyone because everyone comes to the table with different clinical pictures that includes a limitation of their growth cycles and other variables that affect that. We use PRP as part of our treatment because over time I was able to make observations with PRP and with different types of PRP and combining it with different formulations of extracellular matrix and looking at our patients carefully. That means seeing our patients every 3 months and documenting results. It has taken a lot of years, a lot of time, a lot of patience to develop this system. Throughout this time, I have literally witnessed a incredible shift in my colleagues' perceptions of the value of PRP for hair loss. When we were doing this work around 2011, 2012, our colleagues, as a general rule, were openly dismissive and did not feel that PRP had any value. Now, of course, in the aesthetic field, we were already using PRP for helping skin, to help wrinkles, under-eye dark circles, to help skin quality overall. We already knew that PRP had benefit. But I would say that from those observations, I knew that PRP was also limited. It can stimulate growth, but the longevity and effect can be somewhat limited. And so in our practice, we do our hair regeneration treatment system based on a combination of extracellular matrix with platelet-rich plasma. And further, I also would want to teach you a little bit about the history of PRP. PRP was originally developed by oral surgeons who were trying to improve outcomes with dental implant surgery. They did a very simple spinning of the PRP and essentially worked in very, very basic circumstances, no fancy machines, just a centrifuge. And they got very good results. Further along, we have a lot of use, we found a lot of use in the field of orthopedic surgery. So orthopedic surgeons are using PRP for a lot of different issues in joints. Now, in the marketplace, there are a lot of different companies that claim that their PRP is better than others, and they claim higher concentrations, different processes. But when you look at anybody making these claims, can they back them up with clinical evidence? And I would argue that it is not likely. Why is that? In order to prove one type of PRP is so much better than another type, you need, especially for hair loss, you have to have very large numbers of patients and make very objective comparisons. You can do split scalp studies, you can match patients, but you need large numbers, and you have to be able to show a distinct advantage. But in the end, my perspective is PRP alone is simply not enough, and that in our practice we have patients who come from all over the world. We've already established that the hair regeneration system, TrichoStem Hair Regeneration, we can get years of benefit. Now, in this point in time, I've ultimately developed not only an algorithm for treatment, but also this classification system with the variables I described, and from that we've developed treatment plans. What I would argue to advocate for the individual patient is look at the clinic and ask the question, how successful is your treatment? What is the follow-up process like? When we do an evaluation of our patients, we spend time not only doing regular photography with digital camera as well as microscope photos, an extensive evaluation of medical history, but we follow our patients every 3 to 6 months, and we do that for years, and that's part of a treatment plan. We generally do one injection. We follow our patients to see when there's a plateau, and depending on their clinical picture, we decide if there is a value in a second injection. Now, when you evaluate clinics, if they're offering you a better treatment because they have a more expensive machine, I don't think that's a neat reason to choose one clinic over another. I've seen over the past several years, as people have recognized the value of PRP for hair loss, which has been finally published in the dermatology literature, that doctors are using different machines to try to differentiate themselves. It's very similar to what we see with lasers. Everybody claims to have the best laser, but it's not the laser, it's not the device, it's the doctor and their clinical judgment. Look again at the doctor who's offering you these treatments. Look at their experience. Look at the numbers of patients that they can show you of theirs and their before and after photos, and see if they really stand behind their work and are going to follow you closely. Hair loss is not just getting PRP treatments. Hair loss is management. It's looking at the whole patient and the whole picture. So I would actually say be cautious of anybody who claims to have a better machine and therefore is going to charge more. As a cosmetic surgeon in a practice where I do surgery, eyelids, facelift surgery, lasers, I have so many lasers. I do injectable treatments. I can buy any machine I want to help my patients. And when I looked at all the different types of PRP, and as we've developed it over time, we feel we have a good quality PRP in what we use, but we need the extracellular matrix to be part of that whole formulation to get the most optimal results according to our clinical experience. And we support that clinical experience by showing our patients extensive numbers of before and after photos. So I hope that was helpful. I wish you the best of luck. Thank you for your question.